Hello, I'm Dr. Evelyn Reed, and welcome to the Florida Elder Care Training Series. A diagnosis of dementia can be overwhelming and confusing, both for the person receiving it and for you, the caregiver. Understanding what is happening to the brain is the first critical step in navigating this journey. When you understand the disease process, you can respond more effectively, reduce frustration, and provide the compassionate care your loved one deserves. Knowledge is empowering. Today, we will explore what dementia is, the common types, its symptoms and progression, and the foundation of effective dementia care. First, let's clarify what dementia is. Dementia is not a specific disease itself. Instead, dementia is an umbrella term, a syndrome, that describes a collection of symptoms severe enough to interfere with daily life. These symptoms include a decline in memory, reasoning, communication, and the ability to carry out everyday tasks. It's also important to understand that dementia is not a normal part of aging. Dementia is caused by physical damage to the brain. Nerve cells, called neurons, stop communicating effectively, lose connections, and eventually die. This process is progressive, meaning the symptoms will gradually worsen over time. Many different diseases cause dementia symptoms. Let's look at the 4 most common types. Alzheimer's disease is the most common cause. It is characterized by the buildup of abnormal proteins, amyloid plaques, and tau tangles in the brain. This typically results in a gradual decline, with short-term memory loss usually being the first noticeable symptom. Vascular dementia is the second most common type. It is caused by reduced blood flow to the brain, often due to strokes or damaged blood vessels. Unlike the gradual decline of Alzheimer's, vascular dementia often shows a stepwise progression. A person might be stable, then experience a sudden decline after a vascular event. Symptoms often involve impaired judgment and difficulty with planning more than memory loss. Lewy body dementia (LBD) involves abnormal protein deposits called Lewy bodies. LBD often involves fluctuating levels of confusion, seeming fine 1 hour and confused the next. Vivid visual hallucinations early in the disease and movement issues similar to Parkinson's disease, such as stiffness or tremors, are also common. Finally, frontotemporal dementia, FTD, affects the frontal and temporal lobes of the brain. FTD primarily impacts personality, behavior, judgment, and language, rather than memory. It also tends to occur at a younger age than other types. It is also possible for an individual to have mixed dementia, a combination of 2 or more types. Getting a timely and accurate diagnosis is critical. It helps identify the specific type of dementia, which informs treatment strategies. More importantly, it rules out reversible conditions that can mimic dementia, such as vitamin deficiencies, thyroid problems, depression, or medication side effects. Symptoms vary widely, but we generally see changes in 3 areas. Cognitive symptoms relate to thinking processes. This includes short-term memory loss, difficulty finding words, aphasia, confusion about time and place, and poor judgment. These occur because of damage to specific brain areas. For example, damage to the temporal lobe impacts the ability to store new information or retrieve memories. Functional symptoms involve difficulty performing activities of daily living, ADLs. This might start with complex tasks like managing finances, and progress to basic tasks like bathing, dressing, and eating. Behavioral and psychological symptoms are often the most challenging for caregivers. This includes anxiety, agitation, wandering, hallucinations, apathy, or changes in personality. Damage to the frontal lobe, the center for judgment and emotional control, often causes these personality changes or impulsive behaviors. It is vital to remember that these behaviors are caused by physical damage to the brain. They are not intentional. Often, behavior is a form of communication, an attempt to express discomfort, fear, or an unmet need. While the progression is unique to each person, we typically describe the journey in stages. In the early stage, mild, the person may still be independent, but experiences memory lapses, difficulty with complex tasks, or subtle personality shifts. This is the critical time for future planning. The middle stage, moderate, is often the longest stage. Memory loss and confusion increase, assistance with ADLs becomes necessary, and behavioral symptoms may become more challenging. Supervision is required for safety. In the late stage, severe, the individual requires extensive around-the-clock care. They may lose the ability to communicate verbally, walk, and eventually swallow. The focus shifts entirely to comfort, dignity, and sensory connection. While there is currently no cure for most types of dementia, how we provide care profoundly impacts the person's quality of life. We advocate for a person-centered care approach. This means recognizing the individual behind the disease, their history, preferences, and remaining strengths. As the disease progresses, logic and reasoning fail. We must adapt our communication. The goal is connection, not correction. Arguing or trying to force them to accept our reality only causes distress. We must enter their reality, validate their feelings, and create an environment that is safe, calm, and supportive. Understanding dementia allows us to shift our perspective. We realize that the person is not giving us a hard time. They are having a hard time. While the disease changes the brain, the person inside remains, with a need for connection, purpose, and love. By understanding the disease, adapting our approach, and seeking support, we can improve the quality of life for everyone involved. Thank you for the compassionate care you provide. Remember that knowledge is your most powerful tool on this journey.